Hi, my name is Sofia Celis, and I will be talking about moral injury risks to young workers in long-term care. 53% of long-term care workers in Alberta, included in a recent report, have experienced some mental distress or post-traumatic symptoms at work. Moral injury and distress symptoms caused when someone witnesses or partakes in a betrayal of what is right have also been reported by long-term care workers and described as resulting from workplace factors limiting their abilities to provide proper care. During the pandemic, difficult working conditions and therefore risks to workers' mental health have been exacerbated due to the restrictive public health protocols, pressing needs for resources such as personal protective equipment, and reduced staffing. Young people have shown to have experienced higher levels of mental distress symptoms during the pandemic and typically report lower satisfaction with their jobs in long-term care when compared with older adults. For these many reasons, we want to know, how do young people working in long-term care during a pandemic experience moral injury? While this study intends primarily to generate knowledge about the uniqueness of young long-term care workers and their mental health concerns in the context of the pandemic, we hope that it may also inform policy recommendations and reforms in the long-term care sphere to better support workers in ways most relevant to their needs. We use patient standpoint theory as our theoretical framework to emphasize workers' distinct voices as moral injury patients. The theory is visualized as a grid with disease and ease on the horizontal axis and agency on the vertical axis. Accordingly, workers could fall into the states of being shown on the grid, the main ones being competence, acceptance, crisis and change, and learned helplessness. This study is a qualitative secondary analysis of interview data collected in a broader mixed methods project. A subsample of 16 long-term care workers was selected based on age, under 30 years old, from the 50 who discussed their experiences in semi-structured interviews. We used a theoretical framework to analyze and code interview quotes, which were then divided into themes and interpreted using the theory. There are three major themes of our findings. Under the first theme, uniqueness of young workers, we created two subthemes. In establishing a professional identity, most participants began working at their facility during the pandemic, meaning they took on new and more demanding roles during a crisis in long-term care. As recent graduates, many participants felt the need to take any work they could find, while others felt a responsibility to join long-term care in a time of need. In personal living circumstances, moving out for the first time, being in school while working, and pregnancy during the pandemic were stressful experiences that we identified as unique to young workers. Participants living with family members had to adjust the interactions and space they shared with their families for fears of spreading the virus. Those who lived alone struggled with financial concerns, as well as the guilt of wanting to see other people. The second theme, residents, follows as relationships with residents attracted young workers to long-term care and were described by all participants as the most satisfying part of their job. It was therefore very difficult for young workers to limit interactions with residents and reduce the quality of their care during the pandemic. Here we created one subtheme, dealing with loss, where participants struggled to cope when those around them declined or passed away. In the third theme, workplace conditions, added workloads caused participants to work up to 16-hour shifts. Participants repeatedly described feeling that there were not enough staff throughout the pandemic. Here we created two subthemes. In I'm Only One Person, workers fell short of their own expectations no matter how hard they worked to fulfill their roles, but they also felt guilty for taking sick days. In relationships with coworkers, power dynamics in the workplace were observed especially by healthcare aide roles and newcomers to the field, who were described as being at the bottom of the chain. Despite this, teamwork was very important to young workers during the pandemic, and they felt that they became closer with their coworkers. Our discussion situates findings in our theoretical framework by arguing that moral injury occurs among young long-term care workers in the defensive section as a state of disease accompanied by mixed experiences of agency and control. Here, workers experienced simultaneous feelings of disappointment, guilt, and helplessness. We discussed that limited life experience and frames of reference common to young long-term care workers can create distinct risks for moral injury when combined with the many pandemic-related challenges mentioned in our findings. Finally, young workers are experiencing the power of shared challenges and teamwork as they build professional identities in a pandemic. Their experience will assist long-term care in future crises, which is why it is so important to understand their needs, support their mental well-being, and improve their job satisfaction moving forward. I would like to acknowledge and say a huge thank you to my supervisor, Dr. Bonnie Lashwicks, as well as my colleague and lead author of this study, Kara Cruz, and the rest of the team involved in this project who made my amazing research experience possible. Finally, here are my references, and thank you so much for listening.